The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video is going to demonstrate how to transfer an individual from the bed to a bedside chair using a standing pivot technique. This technique may be useful for someone who has weakness in their legs or who may need some assistance with balance during the transfer. An assistive device will not be used in this video. This video assumes that you have already gathered any items that you may need, such as a gait belt or non-slip socks, prior to transferring the patient into a sitting position. It also assumes that you have already positioned the chair as close as possible to the bed prior to assisting the patient into sitting. The first thing you will note in the video is the position of the chair. To maximize safety during the transfer, you want to minimize the distance the patient needs to travel. If your patient is known to be able to bear weight fairly well and can even ambulate, it may not be necessary to have the chair this close. However, the medical and therefore functional status of our patients can change. So if the patient's ability to complete the transfer successfully is in question, it will always be most safe to have the chair this close. Fasten a gait belt around the patient's waist near her center of mass. Then ensure that her feet are positioned firmly on the floor. You may need to assist the patient in scooting forward in order to position her feet appropriately. Next, make sure the patient has a wide base of support or stance and her feet are pulled under her. She's going to lean forward as she stands so that her center of mass moves over her base of support, and pulling her feet back places them in the best position. As I help the patient stand, my feet are in a wide stance and I keep my back straight. I assist the patient up by using the gait belt to direct her center of mass up and forward on a diagonal. Here, you see that simply pulling straight up on the gait belt isn't terribly effective and is uncomfortable for the patient, compared to using the belt to direct the patient's center of mass forward and up. Also, you'll see that when standing, the patient is holding onto my elbows or forearms. This is preferable to holding on near my shoulders. If the patient were to start falling, she would likely pull on my neck, which could lead to injury. Next, I'm going to maintain contact with the patient with the gait belt as she shifts her weight back and forth to turn. I keep my feet in a wide stance as she does this, because this will make me the most stable. The patient contacts the chair prior to sitting, and I squat down, keeping my back straight as I help her control her descent into the chair. A variation on this transfer technique is to provide additional assistance to help the patient keep one knee extended. To help transfer some patients, you may need to block one leg, usually the weaker one, if they have some asymmetry of strength. This is done by first placing your foot along the outside of their foot and placing your leg across their upper shin. Make sure your other leg is positioned shoulder width apart and slightly behind the leg that is blocking the patient's weaker leg. Assist the patient into standing, as was described in the stand pivot transfer without the knee block. The patient then pivots or shuffles her feet towards the chair. As the patient pivots her feet towards the chair, you may need to keep the weaker leg supported by having your leg against her upper shin to keep the leg from buckling. Lower the patient into sitting, as was described before, while maintaining contact with her weaker leg. Prior to initiating the transfer to the bedside chair, you should assess the patient's potential to tolerate the transfer once you have them sitting at edge of bed. It is best to remain close to the patient and even keep a hand on the patient's trunk while they are sitting so that you can feel if they need any assistance with their sitting balance. A patient who is struggling to sit will also have difficulty moving into a bedside chair. You should also be observing the patient for any signs of lightheadedness, since they likely will have just transferred into sitting from supine. You can also be asking the patient how they feel, as pain or nausea can intensify in the sitting versus the supine position. You can consider conducting the egress or ICU mobilization test to assess the patient's ability to bear weight prior to leaving the bedside. See the Capture Falls website for information on those assessment tools. If the patient has one leg that is stronger than the other, it is helpful to have the patient transfer towards their stronger leg. For example, if the patient has right-sided hemiparesis following a stroke, the chair that the patient is transferring toward should be placed on their left side. It is important to think about which side the patient will be transferring towards prior to even getting them up into sitting, so that the chair can be placed on the most appropriate side of the bed. The transfer will be easier if you transfer toward the patient's strong side, and thus safer for you and the patient. If strength is fairly equal in both legs, it does not matter to which side the patient transfers. If there is an asymmetry of strength, it is important to recognize that if you transfer towards the patient's strong side, going from bed to chair, you would be transferring towards their weaker side, going from chair to bed. If the patient has been sitting up in a wheelchair, the easy remedy is to just turn the chair around or move it to the other side of the bed. However, if the chair or even the bed can't be moved, you should at the very least anticipate that the patient will likely need more assistance going towards their weaker side. Also, if the patient has one leg that is stronger than the other, it might be helpful to have the individual pull the stronger leg back relative to the other one so that it is closer to the bed prior to standing. This position allows the stronger leg to raise the body most effectively to a standing position. Both feet should still be shoulder-width apart. If the individual does not have one leg that is stronger than the other, positioning one foot posterior to the other is less important. But you should still ensure that both feet are shoulder-width apart to maximize the patient's ability to balance once they are in standing. The knee blocking method shown in this video is the one that I personally prefer and find easiest to do. However, there are other methods to block knees during transfers, such as using both of your legs to block one or both of the patient's knees. I would encourage you to consult your therapy staff to determine how to best utilize these techniques with individual patients. Lastly, if the patient is going to remain in the chair after you leave the room, for fall risk reduction, ensure that the personal items and a call light are within the patient's reach, and set a chair alarm if indicated for that patient. It would also be appropriate to remind the patient to call for assistance prior to getting up from the chair.